Hospitals are straining their resources to keep up with the current Omicron surge. Nearly every hospital in Washington is using some form of crisis staffing standards. This means staffing ratios are tighter, or they're moving workers to clinical areas that haven't been used before. It's something they don't want to do, but are making work to provide high-quality care. What isn't helping hospitals is the high volume of people coming to emergency rooms who could find help somewhere else. Esther Bower is here to show us what types of care are best for your family.
Well, Nia, every situation is different, but a good place to start is by calling your primary care physician. They can walk you through the next best steps. If your symptoms are more pressing, let's go over the differences between the emergency room and urgent cares. ERs are where you should go for immediate and life or limb threatening situations. Urgent care is where you should go if something needs treatment today and is important but not severe.
Volumes have been really big, about 20% more than our normal day in our emergency rooms is what we're seeing.
Yesterday, MultiCare's Valley Emergency Room saw 140 patients. Normally, they'd only see around 115. Some people are looking for COVID tests or vaccines, which you can't find at the hospital. They're also coming in with mild flu or COVID-like symptoms, which don't require emergency care. Now, you should still absolutely go to the hospital if you have chest pain, stomach and abdominal pain, or suicidal ideations. Local hospital leaders still want you to come in for essential care.
We don't want you to come to the ER unless you need it. And if you need it, we want you to come to the emergency room.
You can monitor symptoms from home, use services like telehealth, and self-isolate without going to the ER. And as we all try to stay healthy this winter, here's a good checklist to remember. First, call your primary care doctor about symptoms and monitor from there. If things get worse or it's late at night, you can check in with urgent care. And lastly, rush to the emergency room or call 911 for anything severe. And to see a full list of symptoms and where you should seek out care, head on over to KXLY.com and look for this story.